Okay, so welcome to your first class with me. I am Dr. Debayan Mallik, Assistant Professor, Department of Community Medicine. But do not panic, we are not starting a topic on community medicine. We are not starting the subject of community medicine as of now in online recording. I'll just speak about a certain topic which goes by the name of protein, energy, malnutrition as a part of biochemistry. Now, I don't know how much you have been taught. I've got no clue about that. But I'll just stick to my topic today. If you just see the name that is present on your screen, it says protein, energy, malnutrition, which is, if I ask you to say what does this means, it's very simple. When there is a deficiency in protein and energy, it leads out to a kind of malnutrition. So I'll just speak very briefly on it. So PEM, or protein energy malnutrition, is a condition that results due to insufficient amount of energy or calorie intake. So there is basically a deficiency of amount of energy or calorie that you are intaking. It mostly occurs in the weakling and the children in the first year of life, mostly seen in the low socio-economic group. And it is not only an important cause of childhood mortality and morbidity, but also leads to permanent impairment of physical and possibly mental growth of those who survive. So why PM is important? A, it is because of less amount of energy intake that actually the body requires. It is much more deficient than that. Secondly, mostly the children in the first year of life and weaklings, the weak people, they have this disease, which is majorly seen in the people in low socio-economic group. And why it is very much important? Because it causes a lot of mortality and morbidity, and also leads to permanent impairment of physical and mental growth. So the mental growth will be mentally, the patient will be a bit of mentally retarded, and physically he will not be of a proper structure that you expect him to or her to be. So this is a picture of young kids suffering from protein energy malnutrition. If I ask you to give a good glance at the picture, is there any abnormality that you can find? Just have a look. I'll point it out then. If you have given it a good look at the structure of this particular place. You see, the bones are very much prominent. Look at the rib cages. There is no fat present in the body. However, having said that, just look at this belly. It is a bit larger than it should have been. If I compare it to the other parts of the body, the belly looks distended. This is a classical feature of protein energy malnutrition. And also look at the hairs. They are brittle, they are very thin. So in clinical form of protein energy malnutrition, it is basically described as either of the two diseases. Either it will be a kwashiorkor or it will be a marasmus. So these are the two names that you have to remember till your last year, in your internships also. And it is very much important for the exam, because most commonly we ask a question that differentiate between kwashiorkor and marasmus. Now, incidence of protein energy malnutrition in preschool age children is about 1 to 2%, and majority of the PEM are the intermediate ones, that is the mild and moderate case might go unrecognized. What happens is that many of the cases will go unrecognized because the mother will come and complain to the doctor, "Doctor, my son or my daughter does not eat much and he is not growing normally like other kids of his age group. So we don't give it much of a hint. You take this medicine, you wait for 2 or 3 years, you wait for some time, and you allow the baby to develop according to itself. Huge amount of time gets lost over here. So it goes unrecognized in the initial phases. If we can recognize it in the initial phases, it will be very easy for us to treat the case. Now, another thing, marasmus is much more commoner than kwashiorkor. Now, this is stories. I am not going to into details of it. I'll just tell you in brief what are the causes of PEM. As the definition said, there is deficiency in intake of energy or calorie. So, improper intake of food is a cause. Infections like worm infestations or diarrhea or respiratory infections will cause deficiency of nutrients in the body. Either it will the nutrients will pass out through the stool, or the worm will be eating that nutrient, so there will be deficiency in the body of the child. And major cause of this protein energy malnutrition is related to food also. If the food habits are not good, if the patient does not take proper food that contains proper proteins, then it will again be a major cause of it. Dietary factor, yes. Second, I'll discuss more about it when we come to the community medicine. I'll just be very brief. I don't want to go into much details of PEM as of now for you people. So just an idea of the infection cycle. As we said, inadequate dietary intake. If the food intake is not proper, what is going to happen? The patient is going to have weight loss, retarded growth, lower immunity, and damage to the mucosal linings. This will lead to diseases. More amount of disease and more the problem here, the more will be the duration and severity. Now this disease, what it will do? It will cause appetite loss, nutrient loss, malabsorption and altered metabolism, which again in turn will either lead to weight loss or will be a definite case of or it will actually lead to dietary intake, which in turn again will cause weight loss and all these signs and symptoms. Just an idea of this infection cycle. What are the contributing factors of protein energy malnutrition? Poor environment condition, large family size, poor maternal health, failure of lactation, premature termination of breastfeeding, social and cultural malpractices like diluted cow's milk, discarding cooking water from cereals, and delayed supplementary feedings. So, yes, poor environment is a contributing factor, because poor environment at turn will lead to worm infestations or diarrhea, which will, as we have read in last slide, that it can be a cause of PEM. A large family size means less amount of food for everyone. The amount to feed are more, but the amount of food is fixed. It depends on the income of the family. So if the amount of food that comes into the family is fixed, when the number of mouth increases day by day, so automatically that will lead to deficiency in proteins and energy and all the other nutrients. Poor mental health is also another cause. Failure of lactation will do a huge harm to the body of the baby, because the baby is not getting adequate proteins and energy that it should get. Premature termination of breastfeeding, because many of the poor low socioeconomic women, because they are daily laborers, they are working to run their family, they leave the baby at home to go to work, so that will lead to premature termination of breastfeeding, because they have to get back to the job at the earliest. Then there are social and cultural malpractices, like we give diluted cow's milk, which is very bad for the body of the baby. I don't know whether they have taught you or not. If not, we'll come to community medicine. We'll talk a lot about it in the nutrition section. Discarding the cooking waters from the cereals and delayed supplementary feeding. Now, early detection of PEM is very important for proper treatment of PEM. And the first indicator for PEM is underweight for age. If you know, there is a chart where we actually put down like this, the age goes somewhere over here, 5, 10, 15, 20 years of age, and we put weight over here like 5, 10, 15, 20, 25, 30, like this. So ideally, with the increase in age, the increase of weight should also be that. This is just an imaginary line, it's not the actual one, just giving an idea. However, in case of these babies, what happens is that the curve is ideally supposed to be like this, but it will go somewhere like this. So this is where it should have been, and this is where it actually is. So this is a clear indication that the baby is suffering from PEM because he is underweight. Age is increasing, but the weight is not increasing. So it is underweight for the age. Ideally, the weight, let's say at 10 years of age, if I put it like this, it should have been 20. Just explanatory, just trying to help you understand. Okay? It should be somewhere like this. Let's say, however, it should be 15. But however, for this kid, it is somewhere around 8 or 9 or 10. So this is a clear deficit in weight of how much? Let's say 6 kg. 6 kg of deficit. So this is an indication that the baby is suffering from PEM. How do we interpret? Let's leave it for some other class. Yes. No, this is also not important for you right now. What are the investigation that we can do for PEM? We need to do full blood counts, blood glucose profile, septic screening, urine and stool for parasites and germs, electrolytes, LFT in general, chest X-ray and Montauk's test for detection of TB. We have to exclude HIV and malabsorption. Other optional tests which we can do are hair analysis, skin biopsy, urinary creatine over proline ratio, and measurement of trace element levels like iron, zinc, iodine, etc. Now, what are the complications of PEM? The complications are hypoglycemia, hypothermia, hypokalemia, hyponatremia, heart failure, dehydration, shock, and infection. I hope that you guys know what is hypoglycemia, hypothermia, hypokalemia, hyponatremia by now. So I'm not going to those things. Preventive, yes. I'll not go to all these details. I'll just say over here that health promotion is most important for prevention of PEM. How can you do health promotion? By telling the mothers to breastfeed, at least exclusive breastfeed for at least 6 months. Then continue breastfeed for another 6 months with top-up foods. This you have to do for proper development of the baby. We can ask them, yes, low-cost weaning food can also be asked to be given to the baby. Proper nutritional education to be given to the family, and family planning and spacing of birth is also another important aspect. In case of specific protection, we can say give milk, eggs and fresh fruit to the baby after 6 months of age, and proper immunization has to be done. Now, how can you do early diagnosis and treatment? For that, we have to do periodic surveillance. This is the most important. Periodic surveillance is very important. If you do that, majority of the cases will get detected in the early phase itself. And deworming of the babies, that's why deworming is done in the school these days, just to help the baby to overcome if there is any chance that he or she might be suffering from PEM. Basic treatment, I'm not going into this. Yes, this is a picture showing 2 cases. One is kwashiorkor and one is marasmus. If you can see, the classical presentation in kwashiorkor is this pot belly. If I ask you to differentiate between a kwashiorkor and marasmus, this is one of the classical feature which you will find. But however, marasmus might also present with a bit of abdominal distension. So it will be your clinical acumen and your experience that you have to put into use in order to differentiate between a kwashiorkor and marasmus. We'll take all these things in next year. In case of kwashiorkor, you can also find itchy rashes and xerosis. In case of kwashiorkor, in marasmus, there will be prominency of the bones and decrease in subcutaneous fats. This is a huge chart for you people. I don't know how much we will able to take it as of now. I'm just putting it over here. So just pause the video, give it a glance. I'm not going into details as of now. I don't want to overburden you guys and also PEM is very tough to complete in a whole single class. So we'll try to be as short as possible. So just have a glance and we'll come back and discuss more about these things. Okay, so continue further. This is another picture of a baby suffering from PEM. There is prominency of the ribs, you can see, and protruded belly. These are again pictures of PEM. Yes. What are the underlying causes of poor diet and excess of disease? As per UNICEF, A is insufficient access to food, inadequate maternal and child care, poor environment and inadequate or lack of access to health services. See, the management in brief, I'll talk about it. It can be done in 3 phases. A, initial phase, B, rehabilitation, and third is follow-up. If I talk about initial treatment, what are the initial treatment that you can do? Life-threatening problems can be identified and treated over here. Specific deficiency, mineral-wise, metabolic abnormalities can be corrected and feeding can be started. In case of rehabilitation, intense feeding has to be done and emotional, physical stimulation and support has to be provided, and the mothers have to be trained for proper caring of the baby. In case of follow-up, we have to prevent the relapse of PEM and assure continued development of the child. Yes, another criteria. No, I will not give it to you right now. You guys might not like it. This is also just another pictures. I'm not going too much into it. Just pictures of patients suffering from PEM. We'll discuss all these things when you are in community medicine. So this is just an introductory. This is how the babies suffer. If you can see this picture over here, look at the condition of the baby. The baby has got no fault of his own. It's because of the low socioeconomic condition of the family, the baby is not getting proper and adequate food. That's why this is the condition. If the proper food had been actually given to the baby would have have developed like any other kid. Yes, continuing of breastfeeding is one thing that we have to tell the mothers. There is nothing much I want to give as of now. So let me just come back to this picture once. So with this, we just wanted to give you a brief about the kwashiorkor and marasmus. So I'll just go into the slide because I still have some time for you guys. So the thing is that if I have to differentiate between kwashiorkor and marasmus, there are certain features we have to take into account, and it is very important for you to know about them. One is muscle wasting, fat wasting, edema, weight for height, mental changes, appetite, diarrhea, skin changes, hair changes, hepatic enlargement, and these are the biochemical factors. In case of muscle wasting, it is present in both the cases. Present in case of both kwashiorkor, present in case of both marasmus. However, marasmus, it is quite evident that there is muscle wasting. Muscle wasting means the size of the muscles are shrinking because of less amount of protein in the body. The muscle proteins are getting degraded and getting utilized for energy, for creation of or for energy deficiency in the body. In order to overcome that deficiency, the muscle proteins have been getting broken. That's why the size of the muscles are reducing. You can see that the muscle is like it has been twitched a bit. But in case of kwashiorkor, it will be hidden because of edema. Because in case of kwashiorkor, there will be edema. That's why the same muscle wasting might get hidden and you might not be able to identify, yes, that the muscle wasting is present over there. Fat wasting, in case of marasmus, there will be severe loss of fat. However, in case of kwashiorkor, often retained. It does not lose much. Edema is not seen in marasmus, but edema is quite evident in case of a kwashiorkor patient. Appetite is good in case of marasmus, but not very good in case of kwashiorkor. Diarrhea is often present in both the cases. Skin changes will be there in kwashiorkor. Hair changes are very negligible, but there might be at times brittle hairs. Another thing is hepatic enlargement. Hepatic enlargement will never be there in case of marasmus, and it will be there in case of kwashiorkor only. So with this, I'm ending today's class. I don't know how much I had been able to tell you or make you understand, but yes, there is a lot to talk about. It is not a one-day class. We have to discuss a lot of things. We have to make you understand a lot of things because it is a very common cause of morbidity and mortality in the society today. And as a doctor, you are supposed to know every bit of PEM because you are going to get a lot of malnutrition patients in your child. You just have to identify that whether it is a case of protein energy malnutrition or not. If you can do that, then it will be worth saying that you are an MBBS doctor. If not, you are no better than any other quacks. So I hope that we'll see you soon. Till then, have fun, stay safe. Bye bye.